And welcome to the Dr. Bob Show. Wow, what's bothering my eyes? They're driving me crazy. They're itching and they're red and they're tearing. Is it allergy? Do I have pink eye? Nobody else in the house has pink eye. It's supposed to be contagious. Did I scratch my eyeball? No, that's usually not both eyes. They're red. Well, is it COVID? Does that bother eyes? Does the treatment for COVID bother the eyes, or is it just allergy? We're going to be spending most of this show differentiating allergy in the eyes, nose, throat. Is it allergy or is it cold? And we're going to talk about what we can find out about why allergies are causing so much problem. My guest is Dr. Laura Green. Dr. Green is a board-certified allergist, and I'm going to try and keep my focus on just allergies and how they can bother you, make you tired, ruin your life. She'll answer our questions. I'm Dr. Robert Overholt. I'll be here with you also, learning about allergies and teaching allergies and having a great time. Should be a great show. I'm looking forward to it. You're going to love the show. We're talking with Dr. Laura Green, board-certified allergist and immunologist, and we're going to be talking about what is driving me crazy this time of year, allergies or infection. Dr. Green, welcome to the Dr. Bob Show.
Hi, thank you.
It's nice to have you here. You're a great teacher. I've had you here before, and I'm looking forward to this show. So tell me, what's out in the air this time of year, mid-March, that's causing people symptoms of anything?
Well, it could be really several things. Usually around this time of year, we're starting to see some of that spring pollen, which in this part of the country, we're starting to see tree pollen in the air. And it's when we really start to see some of that yellow pollen hitting the cars. And
you can write your name on it. Is that pollen that you can write your name on?
It is.
So if I took a little bitty patch of pollen like that, and looked under the microscope, how many pollen grains would probably be there?
Oh, you could see a bunch of them.
Oh, just a whole bunch.
They're very small.
Almost microscopic?
Microscopic.
Do they fall from a tree to your nose, or do they spread in the air?
They spread throughout the air, and those are the ones that really tend to cause people a lot of problems, are not the pretty flowers or the pretty trees that have a lot of pretty blossoms. It's the ones that have their pollen that's dispersed widely by wind.
So the pretty flowers are pollinated by
bees, insects.
By insects. And they're designed, actually, when the bee goes in, it catches the pollen and flies to the next flower.
Right.
But elm tree has a little thing that hangs down, or oak tree does. Are those ugly flowers?
They're ugly flowers. They're not as attractive to bees and insects, and so they have to rely on the dispersion by wind, or we call them wind pollinators. And they can travel for hundreds of miles so that they can cross-pollinate between plants.
So how do you avoid them?
You can't.
So they're everywhere you go. Mm-hmm. And we'll talk about some things that we can do to improve that. So the flower on a tree that's blooming right now, that's not really pretty, and you might even not know it's a flower, disperses and comes. How does it attack the eyes and the nose?
So one thing that happens is you breathe it in through the nose, and it's not supposed to be there. So the body can tag these things as foreign and create an antibody response, so that the next time you breathe it in, your body's all ready to go with appropriate antibodies to attack those foreign particles.
Wow.
And create an allergic reaction.
So it's an antigen that would be what? The antigen antibody. The antigen would be what?
The antigen would be the pollen.
That'd be the pollen that hooks up to an antibody that's where?
that's in the nose, and we
Okay.
call those the IgE antibodies.
IgE, is that the allergic antibody?
That's the allergic antibody.
Are there other antibodies?
There are.
Ones that fight off infection?
Correct.
Same families?
Same cousins.
Cousins, that's the best way to put it. And as I remember, the IgE, the allergic antibody, part of it wants to hook up to a mast cell, has an affinity for the mast cell.
It does.
What's in that mast cell that causes trouble?
The mast cells have a lot of different things that can really make you miserable. Histamine, leukotrienes, other cytokines. And when those mast cells degranulate, all of those chemical mediators are really dispersed, and that's what tends to cause the itching and the runny nose and the swelling. And that's what makes people miserable with allergy symptoms.
Do we have medicines that might help that if we're getting itchy and sneezy because of huge names you said, leukotrienes and cytokines and all of the stuff that comes out of a mast cell? What's the main one that makes us itch and run and sneeze?
Histamine. We have a lot of histamine that are released from mast cells, and there are good medicines that can help with those symptoms, and you can find them over the counter at your local store.
So those chemicals that come from a degranulated mast cell, histamine, what symptoms do they cause with the nose and the eyes?
So you can have itching, you can have runny nose, and you can have stuffy nose. Sneezing would be a big one. Itchy eyes, that's what tends to bother people the most, are the itchy eyes.
I've always watched people scratch their eyes, and I would think they do this, but they seem to want to put their whole fist in there. Is that because it's just...
It's just so awful. It's just so itchy.
I was in a bank one time, and somebody had itchy eyes, and they were red and swollen and puffy, and the mother came in, so I've got to take my doctor to look at pink eye. Does allergy eyes look like pink eye?
They can really look very similar. We call both of those conjunctivitis, which just means inflammation of the conjunctiva in the eye, and that can be from allergies. It can be from viral illness, which is what we refer to with pink eye. But they can really present with a lot of the same symptoms, and it's important to know which one it might be because one's contagious.
Which is contagious?
The viral form of, or pink eye, is contagious,
Yeah,
and you'll know.
It spreads in the house like. But at the same time, the allergic family goes outside, and everybody gets both eyes too. So it's sometimes very difficult. Have you ever seen it so bad that it looks like there's gelatin on the eyelids?
Yes, and those can become pretty serious for patients who have severe allergic conjunctivitis in particular.
So if we're teaching mom and dad what allergic conjunctivitis looks like, it's red, puffy eyes, and the child's having trouble, and see the doctor and let them decide.
Yes.
Okay. What are other physical findings above the neck with somebody that's having that allergic reaction?
So for kids who have the reactions quite a bit, you're going to see some hallmark things. One thing that we see frequently is a line across the bridge of the nose or a horizontal nasal crease from sniffing. We call that the allergic salute from
right.
pushing up the nose.
So if people would look under the mirror and they push their nose up, they can see, they can make their own allergic crease.
Correct. Around the eyes, from chronic nasal congestion, we'll see dark circles under the eyes. So children or adults that have frequent stuffy nose, they'll have those dark circles or what we call the allergic shiners. And they may even have some little lines right here from the puffiness, and those are called Denny's lines.
And so if you really puff up your eyes with your hands to fake it, you'll see those lines. And the dark circles, so that's because there's congestion and they can't drain because of stuffy nose?
Correct.
Okay. So allergic shiners, Denny's lines from rubbing the nose. When you sneeze, is it a blast here and a blast there, or is it fits of sneezing?
It can be either, but usually it comes more than once.
Okay. So 4 or 5 times? What's your record? What's the most the patients told you they sneeze in a row?
I think my record has probably been about 4 or 5 times.
Okay. So being an older allergy physician, I had one patient said it's always 11 times when they say, and it's very difficult. People, when they sneeze, you cannot sneeze. Try it. You cannot sneeze without closing your eyes. So if you're driving, fits of sneezing, it can be dangerous too from that standpoint. What's the nose look like?
The nose or the nasal mucosa of an allergic patient is going to typically be pale. It's going to be very swollen, or we'll say boggy, because it's just that pale, inflamed mucosa.
Yeah, and is it typical?
That's pretty typical. We can usually look inside someone's nose and at least have a pretty good idea if they're going to test positive on skin testing.
So there's certain ways the nose looks, pale, wet, boggy. If it was infected, what would it look like?
It'd usually be more red,
Inflamed, swollen, maybe some yellow stuff. What's the throat? What happens in the throat?
People get a lot of drainage down the back of the throat, and it causes what we call cobblestoning, which is some swelling of the lymphoid tissue in the back of the throat, and it'll look like a cobblestone street. And patients will notice that when they swallow, it feels like there's something that they can't get out of the back of their throat.
Have you ever heard this noise in a cafeteria? Oh. That's people who are scratching that itching in there. So there's lots of, are there good medicines for that?
There are good medicines, and they're readily available.
And that's what we're going to be talking about when we come back. If you've got fits of sneezing, runny nose, red eyes, itchy eyes, driving you crazy, don't feel good, allergy or cold, it may, you don't know sometimes until you see the doctor, but there are good medicines out there. We're going to learn about what those are, and some are over the counter. We're talking with Dr. Laura Green, board-certified allergist, trained at Medical College of Georgia, one of the leading clinical programs in the United States. I think it's the best personally. And she is smart as a whiz, and we're talking about allergies. We went through the allergy reaction, antigen, antibody, tree pollen. The pollen that comes from trees, you almost have to look at a microscope. It really is not normally visible, but it is the yellow stuff on the car. And now we're going to be talking about treatment. When you're talking about treatment with allergies, can you treat it? Can you avoid it?
There are a lot of things you can do. One first step is just to use things that will help get your symptoms under better control.
Like what?
So there are really good antihistamines over the counter that you can take by mouth. And they have decent ones now that shouldn't be as likely to make people sleepy.
So the old-timey antihistamines a lot of times made people just go to sleep.
Benadryl is not a great allergy medicine. We have better things out there.
So Benadryl, when you look in a sleep medicine, Benadryl's diphenhydramine, and there it is on all sleep medicines, and yet it's used as an antihistamine. Good antihistamine?
There are better antihistamines.
That's a good way to put it. Okay, can you avoid allergens?
You can try, but depending on what you're allergic to, it's really hard to completely avoid them.
So name me a couple of things you can do as far as avoiding pollen when you go outside. Can you do that?
If you're allergic to pollens, you're going to want to keep the windows up when you're driving your car. You're not going to want to air out your house in the springtime when you're doing your spring cleaning. You're going to want to keep doors and windows shut. For people who are very allergic to pollens and they have to be outside to mow the grass, you're going to want to wear a mask.
Does that help the eyes?
It's not going to protect your eyes. You can use protective eyewear or goggles, and that will help.
Okay, what antihistamine do you like for the eyes?
For the eyes, I would use an antihistamine eye drop. Now, if you're talking about tablets, I like cetirizine, which is the generic for Zyrtec, or I like fexofenadine, which is the generic for Allegra. Those are two good ones that are pretty effective.
Zyrtec and Allegra and their generic forms that you can get over the counter,
yes.
Are the ones over the counter just as effective as the doctor writing the prescription?
You're gonna do just as well with the ones over the counter.
So it's perfectly okay to get fexofenadine, which is a generic, instead of Allegra, or for getting the Zyrtec.
Correct.
Cetirizine.
Correct.
Make you sleepy, either one of them?
Cetirizine tends to cause a little bit of sedation in some patients, and that should go away after a couple of days with repeated use. Fexofenadine or Allegra is the least likely to cause sedation, and at least at one point it was the only one that pilots were legally allowed to take and fly a plane.
So pilots can use Allegra, so you can feel pretty good that the government says it doesn't make you sleepy.
Right.
In general. Now, after you've used antihistamines and they help you, they block the reaction, where do you go to next?
So if you wanted to pick one medicine that was going to help, you would want to use a nose spray like fluticasone, a steroid nose spray. And one of the reasons that this is going to be more effective for most patients is that it blocks not only the early phase of an allergic reaction in the nose, which is the itching and the sneezing and the runny nose, but more importantly for most patients, it's blocking the late phase. And that's what occurs 6 to 8 hours after you breathe things in that you're allergic to, and that's the stuffy part. That's the congestion, and that's what bothers people the most.
So if you ask 100 patients that have allergies, what's their worst symptom? Most of them would say what?
I can't breathe through my nose.
I tell you, it's stuffiness. How about drainage?
Drainage, postnasal drainage, especially at nighttime, causes a lot of nighttime cough. People don't sleep well. When you don't sleep well, you have daytime fatigue, and it's just a vicious cycle.
So that's inflammation. So you have to, from the allergic reaction, those chemicals that you mentioned earlier, the leukotrienes and the other chemicals that are given. So here we're talking about allergy reaction making people feel crummy. The antihistamines block that, or it takes a steroid nasal spray?
It's really going to be best if you use a steroid nose spray. And that's what I tell my patients. If you were going to pick one medicine to start with the steroid nose spray.
Can you get that over the counter?
You can.
Where?
You can get it in the pharmaceutical section, and usually it's labeled allergy.
Yeah, and so it would be either Flonase or fluticasone?
Fluticasone is the generic for Flonase, and then you have Nasacort,
Nasonex, some of the others. But I think everybody knows that probably the one that does the best job is fluticasone. It gets through the cellular level and does better. So it takes away inflammation, blocks the allergic reaction. What if that doesn't work?
So you have options. We can either escalate medications, and sometimes people prefer to do that. We have antihistamine nasal sprays, and when you pair that with a steroid nose spray, the combination actually works pretty well. But if patients don't like using nose sprays, or if they've tried everything that we have in our arsenal over the counter, it may be time to think about allergy shots.
So allergy shots, what are the pros and cons?
So we'll start with some of the cons, because that's usually what people want to know. They're time intensive. We do have to start patients out on shots twice a week for the first few months. And for some patients who travel for work or who live far away from a shot clinic, that may just not be feasible.
Can you get them at home?
You should not administer allergy shots at home.
Why?
There are strict recommendations against that. You could precipitate an allergic reaction and potentially cause death from an allergy shot.
So we see people sometimes that are getting allergy shots at home, and we feel, and our governing body feels, that
they shouldn't be getting them at home. You should get allergy shots in a medical facility with medical staff on site who are well trained to treat an allergic reaction if one should occur.
If you got one that occurs, what would it be like? What do you have to be ready to treat? Why does the doctor have to be there? What are you treating?
The biggest thing we're looking out for would be airway compromise, so you feel like you can't breathe. Cardiogenic compromise, feeling like you're going to pass out or not maintaining your blood pressure. It can be serious, and it's very rare that happens, but if it should happen, it would be best if you were with medical staff who could treat you quickly and recognize it quickly.
So in general, allergy shots, Name me 2 or 3 reasons you should take them. They'd be
Allergy
good.
shots are the one therapy that will treat the allergy and not just the symptoms. So you're helping the immune system build immunologic tolerance so that when you encounter these things in the environment, your body's not producing the same hypersensitivity reaction that it was before.
Almost makes the allergy go away. We call it tolerance.
Right.
One other reason?
It will reduce the risk that patients either will develop asthma, or if patients already have asthma, it will help keep it from getting worse.
So it's protective against getting or making asthma worse. The allergy shots, can they help asthma?
They can. It's very important if a patient has asthma that it be well controlled before we start allergy shots, but that's always something that we discuss with patients.
Is it easy to know how long they should take shots? Because that's what we're going to be talking about when we come back. And I can't wait for the answer, because that's a question that people have. And we're going to answer how long you need to take the shot. Sometimes it's not as easy as you think. You'll want to stay tuned. We're talking with Dr. Laura Green, board-certified allergist, trained at Medical College of Georgia, which I think is the leading clinical allergy program in the United States. And she's a whiz-bang. She is very, very smart, very well trained, and I love having her on the Dr. Bob Show. We've talked about the allergic reaction, we've talked about treatment, we've talked about avoidance, we've talked about pills, we've talked about sprays, we've talked about allergy shots, and now we were going to ask, how long do people need to be on allergy shots?
Really, patients should try to stay on their shots for a minimum of 3 years to have best chances for long-term success with the shots.
Can they get well in 2 years or a year?
They can start feeling much better in 1 year to 2 years.
Hey, that quick? How quick can people start feeling better from shots?
We say that patients should really have been on shots for at least a couple of months on maintenance dosing to notice improvement. I have a lot of patients that feel like they immediately start to notice improvement in their symptoms, and I have to assume some of that is placebo effect. But
what does placebo effect mean?
it's where you know that you're on shots and you're expecting that you feel better.
And so you do feel
And
better.
so you do.
And the doctor wants you better, and you want to be better, and so there's a bias of saying, well, you're better, aren't you? But really, you're going to have to be on maintenance dose. Now, what is maintenance dose?
Maintenance dose is the dose you're on long term. We have to start patients at a very small starting dose and gradually build up to minimize the risk of the allergic reaction that we talked about before.
And once they get to that maintenance dose?
That's what they stay on long term.
Once a week, once a day? How often?
Patients really should try and stay on weekly shots for the first few months to 1 year, and then we start to space them out more after that.
If you space them out, if you go from once a week to every 2 weeks, do you not get the effects? Or
most people do pretty well with that. What I tell patients is that you can always come more frequently for your shots. If you notice that going into every 2 or 3 weeks, your symptoms don't seem as well controlled, just come once a week.
Yeah, and so that can be, it's a shared decision between the doctor and the patient as to how frequent. Now, at the end of 3 years, how do you make it? How can you tell? Do you reskin test somebody?
I don't reskin test people, but there are a couple of things I'll look at. Number one, have you been able to stop a lot of the other allergy medicines? Do you still need a nose spray every day? If you do, you may not do as well coming off shots altogether. Have you been able to space out your shots? If you can't go more than 2 weeks without getting an allergy shot, you're probably not going to do well coming off of them altogether.
So you're going to need to be on them longer. Or do you stop them? How long do you feel safe in a patient being on shots?
There's not a lot of data that says we have to stop shots at 3 years or that we have to stop them at a certain time. And some patients, if they know that they feel better on shots, they don't have to take antibiotics for sinus infections, then it's okay to leave them on shots as long as you both feel comfortable with that.
If somebody's getting their shots once a month and it's getting time to take their next shot and they get that shot, how much protection do they get from that shot that's a month from them?
They should have good control of their symptoms until their next shot once they've been able to be spaced out that far.
So huge amounts of protection that's not wearing out before the next shot. And then you begin to think about, well, maybe we could try to stop.
Correct.
Okay. So Why is it good to be an allergist?
It's such an exciting time in our field, and really one of the joys of our field is helping patients improve their quality of life. We also have a lot to do with patients who have severe asthma, which can go along with allergies, and keeping patients out of the hospital. So it's a wonderful field, and we have a lot of great allergists here in our area.
When I think of being an allergist and the way you just described it, it makes goosebumps come because it's such a thrill to be a physician. Dr. Laura Green, you are a wonderful allergist, you are a wonderful doctor, and a wonderful person. Thanks for coming to the Dr. Bob Show.
Thank you for having me.
It's been a pleasure. Wow. Now remember those 4 things that we do talk about, that you got to be healthy in order to get your allergies treated. 4 things. Number 1, exercise. Everybody exercise will improve their health. It increases circulation around the heart, makes you feel better, you get a runner's high, makes you happier, makes the people around you happier, helps you lose weight. Exercise is so important. Be sure you're eating properly and be sure you're not allergic to those foods. So if you're eating properly, that means a bigger breakfast, less supper, more fruits, more vegetables. Take the fried food out of there, keep simple. You know what you need to be eating. 7.5 hours sleep? Oh, I don't need 7. Yes, you do. The literature says if you're sleep deprived, you don't perform well. You don't perform well at work, you miss school days, so be sure that you're getting the right sleep for your age. And most of all, what is it that we like in the Dr. Bob Show? It's that laughter in your life. Laugh and giggle and you'll be healthy.